Thank you for all of you for being here on this World Hearing Day. Let me just briefly introduce myself. I'm the permanent trustee and some of the founder trustees that have set up this Lilavati Hospital in the year 1997, which happens to be my late father, Mr. Kishore Mehta, and my mother, Mrs. Charu Mehta. This is a multi-speciality 300-bed hospital which is focused in all kinds of spheres, and we are deal in all medical treatments including cardiac transplants, robotic surgeries, organ transplants, and many more. Lately we have tied up with Mayo Clinic for all various medical services. We are coming up with a state-of-the-art hospital in Gift City, Gujarat, which shall commence its operations in the next 6 months. We have also announced a cancer hospital next door in the heart of Mumbai, which shall also be operational in the next 2 years and shall deal with all complex services and edge technologies, cutting services for cancer treatment. We have off late also announced our latest hospital coming up, a 250-bed hospital with the state government of Assam, and which shall be operational also very soon. As of today, being a World Hearing Day, we have completed more than 500 cochlear transplants for children, implants, for children under the age of 2. This is a cutting-edge technology which has changed their lives and enhanced the lives of these children and contributed more to the Indian economy. I shall now hand over the mic to Dr. Chris D'Souza to enlighten me further.
Namaskar, I am Dr. Christopher D'Souza, ENT surgeon at the Lilavati Hospital. I'd like to express my sincere and grateful thanks to the Lilavati Hospital, to the trustees of the Lilavati Hospital like Mr. Prashant Mehta, Mrs. Charu Ben Mehta, who is a trustee for life, Mr. Rajesh Mehta and Mr. Rajiv Mehta, also permanent trustees. Through their help, encouragement and cooperation, we were able to do these surgeries for these children. These children, as a social service to society at large, the trustees have very generously and graciously allowed these surgeries to happen and have contributed therefore to the growth of the nation. These children who are born deaf have been implanted by the age of 2 years. This allows them to hear clearly. Once they are able to hear clearly, they are able to acquire speech and language. This in turn allows them to enter schools that are teaching children with normal hearing. So we have found that once they have been implanted with both ears at the same time, they develop like normal children. This allows them to get a complete education and move on and get a college education. With a good college education and a good degree, they are able to get a good job. This in turn helps them to lift themselves and their family out of poverty and contribute meaningfully to our nation. So we are very lucky that to be working at the Lilavati Hospital, who gives us this opportunity to serve the disenfranchised society at large. Thank you very much.
Doctor, what is the difference between cochlear implant and traditional hearing aid? And who is the right candidate for the cochlear implant?
Thank you for that question. The question is, what is the difference between a hearing aid and a cochlear implant? A hearing aid requires the person to have some level of hearing. A cochlear implant is done in a person with no hearing. A cochlear implant, when done at the age of 2 in a child, this allows them to hear clearly. The center in the brain directs all the signals which in the brain for processing. This allows them to hear normally. When done in both ears, they are able to develop scholastically and psychosocially like normal children. So they are able to get 50,000 words and so on, speak like normal children. So this is a major advancement. Also, the device is getting more and more sophisticated and evolved. So this allows better features like the Wi-Fi, Bluetooth, live streaming, all that is what they can achieve. Also, the device remains inside their bodies for the rest of their lives. The device is MRI compatible. And if they go through the airport for security, all that they have to do is show them the device, the card, and they will not be stopped. They'll be allowed to pass through. The device will remain inside their body for the rest of their life and function absolutely normally. Of course, like all things, the external part of the cochlear implant needs to be taken care, needs to be looked after carefully. But we have found, we have children who have had the device for 20 years, they are doing very well with the same device.
Yeah, what do you guys have to say about this? This very important day, World Hearing Aid Day. Yeah, what do you want to say?
It's a very good event. Thank you, Shan sir, madam, and of course doctor for hosting this, for running this event. It's a very good event, and I mean this is the first we just started, and as Mr. Mehta said, we are coming on an expansion basis. We are coming up with many other hospitals. Not even Mumbai will be kept. Will be start getting globally as well, and of course the international patients as well. And I'll be very delightful to get more patients. We are happy to host them. As our tagline says, more than healthcare, human care. That's our main motive. And thank you all the dignitaries who have attended this event. Thank you.
Your final words, sir, please.
Hi, I'm Saurabh Sharma, again one of the trustees here. So, as my colleague has already mentioned and it has been said, but then again I would like to reiterate on that part that we are coming up in Gandhinagar as well, and also we are planning to do a similar kind of camp over there as well in Ahmedabad. So we are talking to Dr. D'Souza on this, and we are going to have a roadmap how we can take it forward from here, and there will be not only one, multiple camps will be held, and not only hearing but also more of the cataract surgeries on eyes and all there. You'll see a lot more coming.
Thank you.
Thank you.
Thank you. Thank you.